Good day to you. I'm Dr. Srinivas Chakravarthy. I'm a medical oncologist and a hematologist trained from the USA. And I'm now the Director of Hematology and BMT Unit in Medicava Hospital, Madhapur, as well as the Chairman of the Shubha Comprehensive Cancer Care Limited. Today, I would like to talk to you about something that I think is very important, and it's not really communicated to a lot of people, general public, and to patients and families in particular. And that is how to handle bad news, specifically how to deal with the diagnosis of cancer when you first confront it. The word cancer is very, very traumatic. It has a lot of stigma, it has a lot of anxiety attached to it. And it is a word itself that many people fear rather than the disease. First thing I'd like to tell you is that of all cancers that humans can have, about 60% are actually curable. The rest of the 40%, many of those cancers, although they're not strictly curable, we have made them into chronic diseases. That means we can significantly improve the quality of life that patients lead, and we can also improve the lifespan of patients diagnosed with cancer. I would like you to remember this before you confront the diagnosis itself. When you hear the word cancer from your doctor, when you hear the diagnosis, people are devastated. It's not just the patient, but the entire family and friend circle that is devastated. The ideal way to handle that is to talk honestly with your doctor, with your loved ones, and get the facts. Facts are very important, not myths, not stigmas, not neighborly advice, not well-intentioned advice, but actual facts from a good website and from your own treating doctor. Sit face to face with him, spend a little bit of time, ask for hard facts about what the cancer means, where it comes from, how it can be treated, what are the common side effects that can happen, what realistically can expected to be happen in the future. And don't forget to talk about costs and finances and how to deal with them. Remember, a lot of doctors will help you with finances. A lot of hospitals have separate financial experts who can figure out how to get funds for you and how to get you help if needed. The most important thing is to face the facts and to talk honestly. The other thing that is very interesting in our country is virtually all families say, please don't tell the patient. When a family insists and the patient himself or herself does not want to know, we as doctors generally do not insist on talking to the patient. But I would suggest that it is very important to be honest with the patient himself, both the family as well as the doctor, because there are very few people who don't know what's wrong with them. After all, it is they who are suffering. They can read the notes as well as anybody else. And when you talk honestly and openly and frankly and hold out some optimism and some hope, the vast majority of people are able to handle bad news and come to terms with it. It also opens a two-way communication channel whereby the patient has greater honesty both with his family members and with his physician, and that always establishes trust, and trust leads to better cooperation and definitely better treatment. So be honest, be frank, be open, look for facts, not for myths or stigmas. When you're diagnosed with cancer and you have to start treatment, try and lead a healthy lifestyle. There are some people who have said, I have smoked all my life. Now I've got cancer, what's the difference? I'll continue to smoke. Now the problem with that is during treatment for cancer, if you continue to have unhealthy habits that very badly affects the way your cancer is treated and the way the outcomes are and how you tolerate treatment. It's important to maintain a healthy lifestyle with a good diet, regular exercise, and avoiding tobacco, alcohol, and other habits like that. Also, it's very important to lead as normal a life as possible. A lot of families say, oh mother, I love you, I'll take care of everything. You lie down in the bed, you take rest, don't cook, don't take care of things, you take rest. That is very well intentioned, and those comments and those advices come out of deep love for your parent or other loved one. But Imagine yourself in a situation where you're in prison. You have no control on your diagnosis. You have no control on your own life. You have no control. You want to cling to normalcy. The average patient wants normalcy and heals faster when they feel as normal as possible. So it is important to allow patients to lead as normal a lifestyle as possible. Many people, even while on treatment, can go to work that they normally do, their professions, or do light housework at home. It is important to keep occupied. It is important to feel relevant, and it is important to feel as normal as possible. The support of close friends and loved family is tremendous. That cannot be underestimated at all. So always trust those closest to you. Trust those who truly love you and mean well for you. Take their support. Discuss with them openly about what feelings, fears that you have. Take help from them. Take help from the social workers. Take help from your medical system, including your own doctor. When faced with the diagnosis of cancer and when faced with the possibility of a shorter life, people are scared. People are afraid. People are worried about what will happen to their loved ones and what will happen to their goals that they have set for themselves. It is important to sort out your priorities. What is most important for you? Is it the education of your son? Is it the marriage of your daughter? Set priorities and try to fulfill them as soon as possible. Nobody can do everything, but we can achieve those goals which are closest to our heart. Finances are always important. In the typical person's mind, especially in India, the biggest thing that weighs on them is how am I going to be able to afford all this? As I said, help is available. Take help from your social worker, from your financial advisors, and from your doctor himself. Try and find support groups where you will meet other patients who have had a similar diagnosis. Different people respond in different ways to stress. Different people handle the diagnosis of cancer in a different way. They handle side effects in a different way. Meeting your peers who have had the same diagnosis and who can advise you on their own journey gives a lot of support and a lot of mental comfort. Those of you who are in the habit of Googling or talking to laymen, be careful. In these days of social media, there are a lot of myths and stigmas out there. Again, I repeat, it is important to sort out facts from myths, because myths take us down a road that is not healthy. Try to develop your own coping strategies. Spiritualism is very important. Those who are religious habits give a lot of support. Those who have hobbies, it is important to cultivate your hobbies, and pursue them with passion. With care, with skill, with cooperation, and with honesty, cancer can be dealt with and conquered. There is no need to fear. Thank you.